Good morning.
Pre-10 o'clock, we're still a quiet group. We'll get going at 10:01.
Yeah, that's when all the practice starts.
Exactly. I have a feeling on the MaineCare side of things, there's some folks who are in the office today, as opposed to those of us working from home. And I know that folks were going to a central room, and sometimes that causes its own little delay.
Good morning, folks. We'll give people another minute to join.
Kathy, I just want to give you a heads up because we are on the, we are recording because we are hoping to, we made plans to post these onto the MaineCare YouTube so they can go up on the website so that folks can watch the MAC meetings like they should have been, but as the new communications director, I was falling short of my responsibilities. So just wanted to flag that for you, Kathy, that we are recording, and maybe mention that when we really get going.
Thank you. I will mention it. And I also think people do get notified when they join that it's recording. So that'll help.
Oh, maybe it just didn't notify me because I'm the host and it assumed that I knew.
I think that's right.
Hey, Eric, this is Gia. Are we using a different Zoom platform?
Yeah, it previously had been on Kathy's because when Sarah left, because the state's Zoom had some issues. And I took that back to take that off of Kathy's shoulders and created it out of the state's Zoom account.
I noticed with this account, you cannot update your name or your pronouns, organization, and your.
Maybe if I look for some, there may be some administrative powers here that I can loosen that.
Magic wand.
Thanks for catching that, Gia. So as folks are still joining, we'll give about 30 more seconds and then we'll get started.
Another quick question. Hi, Eric, if you don't mind, while people are still joining, would you be able to give permission for participant screen sharing?
Yep, that should be enabled now. And Gia made the point that names could not be adjusted, and I believe that should be addressed now as well. So yeah, if you want to.
Yeah,
Thank you, Eric.
Thank you.
Cool.
Okay, well, let's go ahead and get started with introductions. For those who do not know me, I am Kathy Kilring Del Rio. I use she, her pronouns, and I'm with Maine Equal Justice and also the chair of the MAC, though we are having an election today. I also just wanted to note a couple things, which some of you have already heard, but we'll say again for others, that we are using a new Zoom so that MaineCare is actually hosting the Zoom instead of me. And so if you have any problems with anything, let Eric know. And also we are recording, which you should have been notified of, but just to make sure everybody knows, because we are going to try going forward to have the meetings posted. Before we jump into introductions, any questions about any of that? Okay, so we're going to go into introductions as normal. So we will go through the MAC list and then give a chance for MaineCare folks to introduce themselves and then come back to catch any other MAC members or alternates who we missed, and also guests will have a chance to introduce themselves as well. So we'll go ahead and get started with Esther.
Good morning, Esther Miller, MaineCare Program Manager with the Office for Family Independence. OFI manages eligibility for MaineCare.
Thank you. Laura Cordes.
Good morning, Laura Cordes, she, her, hers. I'm the executive director with the Maine, with Maxby. My apologies. The Maine
No.
Association for Community Service Providers.
Thank you. Jamie Cotnor. Kathy Dion.
I'm Kathy Dion with the Autism Society of Maine, and I use pronouns she, her.
Gia.
Good morning, everyone. Gia Drew, Executive Director at Equality Maine, she, her, hers. Thank you.
Al Durgan.
Good morning, Al Durgan with Spurring Services.
Rachel Dyer.
Hi, I'm Rachel Dyer with the Maine Developmental Disabilities Council. She, her. Thank you.
Leo Delicata.
Leo Delicata, Legal Services for the Elderly, he, him pronouns.
Mark Eves. Mike Hollenbeck. Candy Henderly. Jillian Joliker.
Jillian Joliker from Assistance Plus, she, her pronouns.
Beth Pierce.
Beth Pierce, Oral Health Program Manager with the Maine Primary Care Association, and I use she, her pronouns.
Sarah Lewis.
Hi, Sarah Lewis, she, her, hers, sorry, and I'm with Maine Access Immigrant Network.
Jim Martin.
Hi, good morning. Jim Martin from Sweetser, he, him, his.
Vicki McCarty.
Good morning, Vicki McCarty here. I'm with the Consumer Counsel System of Maine.
Atlee Riley.
Morning, everybody. Atlee Riley, he, him, Disability Rights Maine.
Dee Sabatis.
Good morning, Dee Sabatis, she, her, hers, United South and Eastern Tribes.
Rachel Collmore. Suzanne Farley.
Good morning, everyone. I'm here representing the Alliance for Addiction and Mental Health Professionals, providers rather, and also I'm the Executive Director of Wellspring.
Jeff Tyner.
Good morning, everybody. Jeff Tyner from Catholic Charities.
Susan White. Or Lori Belden.
Good morning, everybody. It's Lori Belden. I'm the Executive Director of the Home Care and Hospice Alliance of Maine.
David Winslow. Okay. So let's go ahead and move over to MaineCare. Eric, I'm going to pass it to you because you're the first person I see.
That's fine. I can start. My name is Eric Isley. My pronouns are he, him, and his, and I'm the Director of Communications and Planning for MaineCare. And then I will pass to Michelle Probert, the Director, who I believe is in the office room with a couple folks from MaineCare.
I am. I hadn't even noticed I had failed to get on Zoom screen myself yet, so I'm way back here and I'll get on in a moment. My name is Michelle Probert. I use she, her pronouns, and I'm the MaineCare Director, and you'll see my face in a couple minutes. Oh, Jenny, you want to go next?
Yes, hi, everyone. I'm Jenny Patterson. I'm running the controls in the conference room. I also have not signed on individually, but I am here and happy to be here, and I will pass it to Molly.
Hi, everyone. Molly Slotsnik, Chief Operating Officer for MaineCare, and I'll go to Mandy Lee, who's also in the room. Okay. Good morning, everybody. Mandy Lee, she, her pronouns, and I am the grade setting coordinator. That's it for MaineCare. Lisa on?
Yes, good morning. Apologies, my computer crashed at the worst time. Just got back on. So Lisa Weaver, pronouns she, her, hers from MaineCare Services.
Is there anyone else from MaineCare?
I don't think so.
Okay. So just check back in quickly. Are there any MAC members or alternates who did not get a chance to introduce themselves?
Hey, Kathy, this is Mark Eves, Executive Director of Woodford's Family Services. Good morning.
Regina Phillips with Cross Cultural Community Services.
Great. Regina, that's a perfect transition to anyone who's a guest who'd like to introduce themselves. You can either take yourself off mute or put it in the chat.
This is Mallory Shaughnessy, Executive Director at the Alliance for Addiction and Mental Health Services, and also an alternate to Suzanne.
Kate Christensen, Oral Health Educator, Maine CDC. I'm here for Nicole Breton with Office of Rural Health and Primary Care.
Teresa Hill, Maine Dental Association.
Okay. So just a few things, because I know a few folks joined after I said this earlier, but to name, we did make a change in terms of the Zoom. And so I'm actually not the host today. MaineCare is, and we are recording this meetings with the hope of being able to post these going forward. So if you are having any like technical troubles or anything, reach out to Eric. And I just realized too, Eric, that I am not seeing everybody as they join, which is totally fine, but I usually try to catch MAC members in case they're late. So I will try to remember to say a few times for any late joiners to introduce themselves. And then we can jump into our agenda, which is beginning with the presentation around My Maine Connection.
Good morning. So as we've discussed in some previous meetings, OFI has done a lot of work to update the My Maine Connection portal. And with us today are some folks who were elbows deep in that work with us from Deloitte. We have Stephen, and I'll kick it over to you and you can introduce yourself and your team, and then you guys can get started.
Hey Esther, it's Jackie. I'll actually kick it off. I know it's hard to see everyone in order. Thanks for giving us the opportunity to do a quick overview and demonstration of the new My Maine Connection portal with a focus obviously on the MaineCare program for this audience. We are putting something together briefly for you. You know, if there are any groups who would like to see more or see anything more in depth, you know, Esther, if you have any requests following the meeting, just let us know, and you know, we're always happy to share more. This is kind of just intended to give a little preview. But I'm actually going to turn it over to my team now. Stephen Yamalis, who has been leading this from day one. And we also have Haley Stokes with us as well. She's relatively new to the team, Esther, so if that name didn't look familiar. But thank you all for having us, and we're excited to show you the new portal. And Stephen, I will kick it over to you now.
Awesome. Thanks, Jackie. Thanks, Esther, and thanks everybody for having us today. We are going to present first just a quick overview of some of the different features that we have in the portal that we're very excited about, and then wanted to actually show a quick demo of what it's like to apply for MaineCare in the portal as well. So to kick off some of the highlights of what's new with this portal than the previous My Maine Connection portal is some major highlights include the document upload feature, which includes the ability to just take a photo directly from your mobile device to upload verification documents. The inclusion of the long-term care program, where you can actually apply for long-term care services, for assistance with long-term care services. Connection to FDSH services to verify eligibility information. So this connects to the Federal Data Service Hub to verify income, verify lawful presence, as well as SSA for verifying Social Security numbers. And this allows us to be able to get that verification automatically rather than uploading documents for those specific items. So in some instances, we can use those services. Additionally, we added the ability to upload to complete a SNAP 6-month report, which is relevant for any recipient of MaineCare who also have SNAP benefits. So that's a new inclusion here too. So the general flows that we have within the portal include the one that many of our users will use, which is the benefits application. It's the big one here. And some major updates here you can see in some of the screenshots are that it's a very easy to navigate flow. The language within this application, as well as the other components of the site, are also at a 5th grade reading level, a lot of instruction text, extra helpful links if needed. There's little buttons that you can press next to different questions in case more clarification is needed. The entire design of the flow follows this application summary, which is the basis of going back and forth through the different sections. So you can kind of follow through to see a sense of completion as you go through the different sections. And we'll see that in just a little bit. As well as existing information can be pre-filled if the user connects to their benefits previously, meaning if they already have some benefits with OFI and they put in some information, they're able to connect, and then they can see the previous benefits and just update the previous information, and they can just update that rather than having to type everything in new. That also helps for kind of data integrity and make sure that we have accurate information and updated. The reported change flow is where a user can make any updates they need to make. They can easily review and edit their case information. This is actually split into 2 different flows. If you need to add a new member, or if you just want to make an update to existing case information, like your address or income or something like that. And we streamline the flow based on what you said you would like to make a change to. And this allows the user really just get in and say, this is what I want to change. And we just queue what they need to see to do that, to make it super quick and easy. So we'll see it all the way over here to the left. This screen is where you can kind of select different items, different areas. If you want to change contact information, if you want to change income, assets, what it is. And then the middle screen here will have the guided summary flow that has you start into the different sections for what you previously selected. And then the last screenshot we have here is showing where you can actually go into either make those updates to individual information or add a whole new member or remove someone from the case altogether. With that flow, typically when you're adding a new member, there's a lot more, it's a longer flow to kind of add everything for that new member. So we kind of split those to streamline that. Similar for renewals or recertifications, these can be completed in the application as well. This uses a very familiar design to the application. So for ease of navigation, so that the user is familiar with the flows. And it basically shows you almost the application, but everything is pre-filled. And then you go through and review it and then make any updates that you need to. There are clear reminders all over pretty much on the dashboard and the message center. As well to notify someone that they have an upcoming renewal and to prompt them to complete it. And here we show an example of in the renewal flow as well as in reporting a change for financial screens, income, assets, and expenses. There's actually a guided flow for updating and editing these to ensure that that is done accurately. Some of the research that we had done prior showed that those were some areas that people tend to struggle a little more with making accurate updates. So we tried to implement something that would guide, just provide a little more guidance. A similar flow here is, as I mentioned before, is the SNAP 6-month report. This is very similar to a renewal. By default, it has a shorter amount of sections that need to be followed per the SNAP 6-month report requirement. And this can expand depending on if we add another member or something like that. We included this here for this audience so that it's known that if someone has SNAP and also has MaineCare on the application, this is also something that's available to them. So they also have MaineCare in their case. Long-term care services mentioned before is something new that we have in the application on My Maine Connection. And this allows you to say that you do need assistance with long-term care services. You can select which type, and then appropriate other questions will also queue there, depending on what was selected. The upload document feature, just some screenshots here to show this. As mentioned before, this could be accessible right from your phone. You can take a photo or you can upload a document from your device. And information is provided here on the exact type of file types that are available as well, that are accepted. The message center here is where we have what we call notifications and to-dos, which will prompt for different activities that need to be completed, such as an unsubmitted application or an upcoming renewal. If you opt into e-noticing, you can also review your notices and letters directly from the portal. And you'll also either get an email and or text message to prompt you to go to the site. We also have system-wide announcements, which we can display to any users if there's something globally that we'd like to mention. I mentioned this before, connecting to benefits. This is kind of how this works, is if the user provides their client ID and either an SSN or alien number, we can connect them to their existing benefits that they have, and that will pre-fill their information and allow them to get individualized notifications of seeing that they have a renewal due, so they can complete those things as well. So that just allows for anything existing, whenever they're creating their account, they can complete this. If they don't complete it when they create their account, they'll have an opportunity from their dashboard. Another update is that pre-screening tool, which has been streamlined to a very quick assessment at a household level. I believe it's about 16 questions, which we'll ask at a high level, household level, and it'll give an idea of potential eligibility for some of the programs that we offer in My Maine Connection. Additional information regarding each of these programs are provided so that you can make a more informed decision of whether to apply. And then we also have some quick information regarding WIC and school lunch programs to view as well. Some quick comparisons between the two portals, the old portal and the new. Just some updates is that in the My Maine Connection portal, the new My Maine Connection, we have a lot of dynamic question queuing based on the program selected. So it really just gets to the exact details that we need given the situation of who is applying and what programs they're applying for, and also based on some previous responses. And also it is a mobile first application, and it's optimized for seamless use on a mobile device. And we'll see what that looks like in just a moment. As I mentioned before, applications can be pre-filled. That helps to improve data quality. And we have the Connect to Benefits feature. And a quick view here kind of shows the difference between the mobile first approach. In the previous My Maine Connection did not have that mobile first approach. You can see that you can access it on a phone, but on the new one, you can see that the buttons are a lot bigger, and the way that you enter it is it fills the screen, and it is meant to be used on a phone. It will adapt directly to the device that you're using. This decision was made primarily because in some of our user research, we saw that many people don't actually have access to a computer, but the vast majority do have access to a smartphone. So that makes it more accessible to those who need to use the system to make the experience optimized for mobile. I'm going to put that in action. I wanted to show a brief brief demo of starting an application and what that kind of looks like on a mobile device. So we're going to switch here to showing a mobile device, and I will stop sharing so that Haley can share her phone. But what we're going to do here is we have a user named Jim, and Jim currently has SNAP benefits for his household. And so he is going to log in to the portal and start an application for MaineCare. So we'll see we're here on Jim's dashboard. And here he has the options right at the top to add other benefits or report a change. We also see a system-wide announcement here. And if we scroll down, we can see some of the information that he already has. He has active SNAP benefits, access to the message center, and other links. So if we go back up to the top, we will select add other benefits, because now Jim would like to apply for MaineCare as well. This first screen basically just gives an overview of the application and steps for how to complete, as well as links for if any help or resources are needed. As we reach the bottom here, we'll select Start Benefits Application, and that opens some information we have to read and agree to in order to get started for the different programs. We will agree, and the first screen that we fill out here is the primary applicant details screen. And this collects information on the name and address of the primary applicant. So we'll type in the address here. And that uses something we call Smarty Streets, which actually, as you type in an address, it'll start to pre-populate from suggestions. If you don't see your address there, you also have the option to manually enter. Here we get to the program selection, and we'll see that since we're already receiving SNAP, we have that disabled for selection because we can't apply for it again. But what we can do is we can apply for MaineCare. And we'll click next. If we wanted to add anyone to our SNAP benefits, we could do that from the reported change flow. But we'll apply here for MaineCare, and this is the application summary, which I mentioned briefly before. And this is really the basis of the application. As you complete the different sections of the application, you come back here, and it does provide a sense of completion, and it gives an accomplishment, and it kind of gives the level of progress. If you need to leave at any time, you can save and exit the application and come back to the application summary to continue. And here we have the household members is where we'll start. And so we'll select Jim here. What we'll see is most of Jim's information is going to be filled out because we already have that for him pre-filled, and he connected to benefits when he created his account. As we look through this screen, I will point out a couple of things I should have mentioned when we started the demo. First one is that all of this is fictitious data in our lower environment, a testing environment that we have. And so we completely made this up and entered this data, as well as we are using a lower testing environment. So we may experience some slowness at some points. That is not representative of what we'd see in the actual production environment, which is a good timing to say that because it looks like we might be facing that right now.
While we wait for that to load, I know sometimes our test environments, especially in the morning, can be a little tricky. If anyone has any questions, I know we're probably running short on time, but feel free to drop them in the chat, or if there's anything, anything you have questions on, Esther, if they come up, please just let us know. We're happy to answer them. We could probably demo this for 2 hours, but we wanted to at least give you a little preview and kind of make you aware of the different features that are available. So Esther, you can kind of guide us and let us know from a time perspective when we need to wrap so that we don't cut it too much into the meeting.
I think we have a couple more minutes.
Yeah.
Okay.
Cool. We'll show a few more sections then, just to show a little taste. So we got this continued and came up. So what we'll do is just kind of show some of the screens here. So I mentioned before some of the little I help icons. That's something that we have throughout. If you hover over any of those, you can see a little bit more help to clarify what we need there. So for the name, it says that it should match official documents and things like that. Our information is pre-filled here for the most part, for most of Jim's information. And anything else that we need to respond to, we will, or we can also make any updates that we need to. And then here we'll select the programs. Since we select MaineCare, we have a sub-selection that we can select as well. Full MaineCare, family planning services, as well as Medicare savings program buy-in only. Since we selected the full MaineCare, that includes that buy-in option. So we don't have that available to select as well. And we're showing that we found the existing case. So as we continue, what we'll see is that the other household member, Jane, also got pulled in to the application since Jim was connected to benefits, and we verified that he has the same address and he's still actively receiving those benefits. And we'll do the same thing for Jane here. And we'll select the same full MaineCare program here as well. If we needed to add any other members, we could do that. If we needed to make any edits, we could do that as well, but we'll just go ahead and continue to the next section. And this brings us back to the application summary with 2 out of 9 sections completed. We'll head over to the contact information section, and we'll start for Jim's first. Some of the sections are split by member. And so we see that here, and we'll start by member here. We'll start with Jim's. If we don't want to make any edits here, we'll just continue to the next section. And that's the nice piece about the pre-filled information, is that you see all of it clearly laid out, but you don't have to make any updates if there aren't any. It just makes it easier to review and get through the flow.
Let's just take one more minute to go through a couple more of these screens, and then we can open for questions.
So we will actually just say that Jane has the same contact information. That's a feature that we have for some of these screens as well. And then for the authorized representative section, we'll start that. That is an optional section. For the sake of time, we'll say that we don't have an authorized representative to add. But if we did, we could add information about who the authorized representative is and what permissions we'd like them to have on our case as well. This relationship section, also it uses the type ahead pick list, as you may have seen in other flows that other screens we had shown here. And the reciprocal relationship will also show up on Jane's. And then here we'll have to fill out tax filing. That's something that we did not have before because SNAP, or for this user, because SNAP does not ask for tax filing information. So what we're really doing here is we're filling in the additional information that we need for MaineCare that we didn't previously need for SNAP, because it's all very dynamic based on the programs you're applying and other information provided. So we can complete the reciprocal screens here for Jane and just see that those will get filled in according to what Jim entered as well, since he said married filing jointly, and we have that they have that spouse relationship. It'll just fill that in for her, and you can just review that to make sure. And then we'll click next, and we can open up to questions.
Thank you. Do folks have questions? I have one that I think you've just answered, but it's related to something that was in the chat. But so if folks are applying, I know this has come up a lot in the past with MaineCare. If someone's applying and there's a section of the application that doesn't really apply to them for what they're applying for, they don't necessarily need to fill in all the information. I guess what I'm trying to get at is we often want people to fill in all the information because they might be eligible for other programs, but also sometimes people just want to apply for MaineCare, especially if they're in the Magi category. So they don't necessarily need to have assets and some other information, and that can be hard for people to pull together and a barrier to applying. So in this dynamic application process, if there's something that they don't have or don't need, they can skip that section, and then eventually an eligibility worker will help them figure out if they did need it.
That's correct. Yeah, there's circumstances based on if you say like I have this specific asset, it's going to then ask you for some specific required fields on that. But yes, it's optional to like enter that information. If they need to work with a worker after that, they could definitely do so.
It looks really slick, and I think some other comments said easy. You know, the interface looks easy. Just filled out the FAFSA for the first time, and I say it's easier than that. So if that's our bar, you guys are doing well. But yeah, it looks really, really intuitive.
Thank you. Appreciate it.
Yeah, I'd like to second what was just said, both in terms of this, and hopefully we can get this PowerPoint so we'll be able to share it with our direct care staff, be able to support clients that are in this process. And yeah, Mark, the FAFSA is no fun, man. I'm on my second one.
You guys aren't giving me much hope for the coming couple of years. I think that we may be able to circulate some screenshots back to Kathy and Eric for distribution to the group. So we're certainly happy to do that. I do want to just add for the authorized representative piece. Yes, you can add an authorized representative to a case. However, functionality in this portal does not exist for an advocacy agency to create their own account and then submit multiple applications on behalf of other individuals. So just a clarifying point there.
That is something that we are working on currently, but currently it does not yet exist in production.
I have a question. This is GF Quality Maine. Is there a way for us or me to go through and just sample to see what it looks like?
We did have a test environment, but that's not open to the public to use.
Was that test environment, did that include other people from different populations to see how they would navigate this?
This was an internal, it was for our internal testing. We did do user testing in another state with pretty much a very similar system. We updated it to be for Maine, for different Maine policies and things like that. However, the same UI and that sort of thing in another state was tested directly with users. And on our initial test, it had like I think it was 94% in our very initial test of very highly successful use, which is for a first round, very, very high. So.
Is there a way though for organizations to do like I understand that the testing environment is no longer available and wasn't open to the public, but I do think something to think about would be if there is a way for staff at organizations to be able to go through the application process, both so that they themselves can better support people, but also I know in some cases it's helpful to have like the application open on your screen while you're talking to someone else to let them know, oh, look in the upper right-hand corner, you can see this or whatever. And I think there's a lot of organizations that are part of the MAC, but also just in our broader network that do that kind of work with people. So that could be a helpful addition.
If I can pop in here, I believe it was Deloitte created a series of YouTube videos of the My Maine connection, like showing sign-ins. And we had asked Dan, the COO over at OFI, if we could share those videos widely, which would show some of that process, Kathy, that you're describing. After I go for my next bullet point, I can share in the chat the link to those YouTube videos, which will show some of the internal process and help agencies understand like what folks will be asked for and what this all looks like.
Eric, I have it. I can share it.
Thank you, Molly.
Thank you both.
This is Atlee. Oh, sorry, Kat.
No, go ahead.
Disability rights. I was just, well, thanks for paying attention to readability. It looks like you thought about that. I was just wondering, some of the other accessibility aspects of it, like tested it with screen readers, things like that. And what standards did you guys, what are you kind of using to make sure?
Yeah, so it was tested with a screen reader for APA. So we do have the alt language for all the buttons for everything on the screen. Generally the language, I say generally because there are some exceptions with some different policy things that we have to say. Some words are not at a 5th grade reading level, but generally we use the plain language guidelines in 5th grade reading level as kind of the standard for all of the language that we used as well.
I also just want to lift up from the chat, Sarah Lewis's comment, and seconded by Alex, that we also are hearing this a lot at Maine Equal Justice, that investing in professional translation of the content and not relying on Google Translate or people having to have someone interpret for them, at least in the overview and introductory sections, would be super helpful for everyone who's assisting people who are not English proficient.
And the languages have been read. So the top of the page, our team went in and tested it, and it's not correct. So that's the thing with professionally translated. It's a bummer that Google Translate isn't there yet. They are with French and Spanish, but the other languages, it's not consistent. So if you're looking for, if you have no idea how much it would cost, seriously, just reach out and call me. There are several different places in the state and outside the state, and it's super affordable to get it professionally translated.
Yeah.
And I won't make promises for OFI. That's not my job, but I will say that as a department, through the health equity grant that we have, we are broadly looking at ways that we can put additional support towards translation and interpretation, and making sure that it's not at the Google Translate level. So we'll be sure to take this advice in mind while we're having those conversations. Thank you.
Yeah, I just want to echo what Michelle has said. We universally hear what you all say, not just here in the MAC, but in other platforms as well. When we work a project, we have a timeline and a budget, and it can be a challenge to make the decisions that have to be made sometimes in order to launch a finished product. We definitely want to see more improvement in terms of translation services. And as Michelle indicated, the department is looking at that very holistically, not specifically for OFI or specifically for this platform.
Thank you. Well, thank you to our guests for this overview. And just to make sure I'm clear, if folks did want to have, I appreciate we'll have the YouTube videos, but if an organization did potentially want like a more in-depth training for their staff who assist people, should they reach out to you, Esther?
Yeah, that'd be fine.
Okay. Thank you. So we'll move on. Thank you. We'll move on to our next agenda item, which is the chair and vice chair election, which we put here because I know in the past, sometimes we've had people join late, so we want to try to have everybody here, but also so that the Deloitte people wouldn't have to stay longer into the meeting. So I'm going to
yeah,
pass
so
it to you.
So I'm going to take over just briefly from Kathy and say a couple of things. First off, as everyone on the MAC knows, I am newer to my role and have been trying to get us caught up and back on schedule for a number of MAC responsibilities that Kathy has been shouldering herself without a partner at MaineCare. And with a partner who didn't understand all the responsibilities of their role. So a lot of appreciation to Kathy for all her work helping me get up to speed on what it takes to run and operate the MAC. One of the things that we need to do is we will be getting reappointment notifications out. Kathy had done some kind of background research with everybody to see who was interested in continuing to serve in their capacity as a MAC member. So expect that you should be getting notifications soon. That's now on. Kathy's done all her work, and it's now on the MaineCare side to get those notifications out. And it is my hope that in addition to taking over the responsibility of hosting the meeting, that we will be able to post recordings of the meetings on the MaineCare page. So if folks miss, or if you have questions about what was said, that'll be available. And to make sure we're on our regular cycle for appointments. Which brings us to the election for chair and vice chair. The election is only open to MAC members. So if you're a member or I'm going to share a link to a form where you can vote in the chat. But please, it's a little bit honor system, but I think once you see the form, you'll see why we're okay with the honor system. We did not get a flood of requests for folks looking to be chair. So I think the honor system will work in this case. But if you are not a MAC member, please don't vote. And anything else that I'm forgetting off of there? I'm going to
say, sorry, just one person per organization. So
right.
If you have backup, only one person should be voting.
Yep. So I will submit the form. I believe we should be okay. Everyone can kind of multitask as we move on to the next subject, and we should be able to tally the votes by the next. I can send Michelle the votes, and maybe you can put it in the update or something like that. All right.
Okay. And Eric, do you want to just name who is?
Yeah, so we have
one.
one person running for chair. That is Kathy. There is a spot to do a write-in if you are interested in writing in somebody else. And we have one person running for vice chair. It's an alternate. It's Mallory Shaughnessy. So right now, there are only, this is why the honor system probably ought to work just fine in this case. There are only two folks running for these positions. So
thank you.
The form has been shared in the chat. Go ahead and vote. I'll be able to see how many folks have voted. And once we're at our limit, I'll pass the results on to Michelle.
Thank you, Eric. And while, as Eric said, I think we can probably multitask. So why don't we go ahead and move on to our next agenda item, which is updates from DHHS. Michelle?
Sure, thanks, Kathy. These might not be in very intentional order, so I'll just give that as a warning. But first, I wanted to note that we as a department have started bi-monthly certified community behavioral health clinic stakeholder meetings. Though that is a project that is being led by MaineCare with very involved support from OBH and OCFS as well. And thank you for those of you who are participating. I also wanted to note, not going to get the effective date on this right, maybe Molly knows, but we might have mentioned this in the last meeting, but I did want to note that we have had a project and intent going on for a while to be able to accept self-attestation of tribal citizenship status. Tribal citizens are exempt from having to pay copays or premiums. OFI was a bit ahead of us to be able to operationalize that on the premium side, but systems-wise, it took a little bit longer on the copay side, but we are happy to report that both of our systems are aligned in our ability to do that. And so that is a good update, and we've sent out some messages and are having ongoing conversations with tribal health centers and Wabanaki Public Health and Wellness around that change, as well as with OFI, obviously. I will also share that last week, I think it was on Thursday, we sent out our rate letters for nursing facilities and residential care facilities. Those rate letters are for rates that were that retroactively are effective July 1. The reason for the delay was that Part Quadruple A, for those of you who don't recall, required that rates for many services, including NIF and res care facility services, support 125% of minimum wage. And the way that we do reimbursement for NIFs and RCFs means that we needed additional data that we don't have in order to be able to determine those rate adjustment amounts. And so there was a data collection effort that we went through with the Maine Healthcare Association and needed to do some back and forth to get the data to where we were able to use it. And so that was the reason for the delay, but that is now live. In addition to the Part Quadruple A adjustments to those rates, it also includes rebasing for NIFs. And then on the res care facility side, it includes a general fund only high MaineCare utilization payment component as well. That was new coming out of the legislature last year. I will also note our PC Plus program that went live on July 1. We are actually already opening up the application process again. We were very happy with the number of practices that applied for PC Plus, but there was some complications for certain practices in terms of their ability to reach the Tier 3 status they were hoping for. Due to some PIN interfaces. And so out of recognition of that challenge, that was one of the factors that went into us deciding to open up the application sooner than we initially intended in order to facilitate some of those practices to be able to achieve that higher tier earlier than a year out, which was our initial plan for reopening that. So practices can apply if they think they have newly qualified for another tier. And just as a reminder, the tiers come with different requirement levels, and those different tiers, there's also different payment levels that increase along with the requirements. But also, if there's practice that just wasn't able to apply the first time around, new practices that didn't already apply can also apply, and the window for that application will be from October 7th to November 11th. And then lastly, last Thursday, we had a stakeholder session regarding the end of the public health emergency. Still don't know when that end is, but we know that it's not in October. And so we had many stakeholder organizations, including providers and community-based organizations that joined that forum. I think we had, Eric, I think we were definitely over 200. I don't know if you have a better number than I do in terms of number of participants, but that was a forum that was held jointly by MaineCare and OFI, as well as the Office of the Health Insurance Marketplace, coverme.gov, and the Commissioner's Office as well. We have a new website, which is mainecare.gov/PHE, and I can put that in a chat. If you were unable to attend that stakeholder session or did not know about it, there is a recording of the session that is available online, as well as the PowerPoint that we shared, and some FAQs and additional helpful information. And that's going to be a good website to go back to. Thanks, Eric, for putting that in the chat. A good resource for folks to get more information. And I guess this is not a new update, but I'll just say in terms of the ending of the public health emergency, again, it is not as widely accepted, but it is not ending this month. We should know, and this is in the presentation as well, we should know by November 12th whether or not the PHE is likely to be extended beyond January. So the next kind of end date, given the 90-day renewals of the PHE, the next end date would be in January. And we are doing the work, assuming that that is when the end will be, but we will know by November 12th whether that is to be the case or not. And I think that's it. Molly, did you have any updates you wanted to give?
Sure. I gave these updates last month, but I will give them again, just another reminder. Today is the soft launch for electronic visit verification for hospice providers. I gave the wrong date last month, but it is today. And our full implementation for electronic visit verification for home health and hospice is still January 1st, 2023. And then the other one is just a reminder that we are still proceeding with the requirements that institutional claims need to have an attending provider type 1 NPI on the claim, and that claims will start denying after this month if the NPI is not, if that NPI is not correctly in the attending provider field. We have been proactively researching claims and looking for providers who might need a little bit of help on that and reaching out to those providers. So we'll continue to do that throughout this month. And certainly if you have any questions, please do reach out to your provider relations specialist. That's what I got.
Thank you. Any questions? Okay, so then let's move on to the rate system updates. Michelle?
Yes, so I am actually going to turn to Mandy Lee in her role of rate setting coordinator. She's going to start giving our regular updates on this topic, and so I'll turn to Mandy. Thank you.
Okay, so I think we shared last month that we had sent out invites for the technical advisory panel, and those have all come back, and those have all been accepted. And so we sent out the e-notice Friday for the first TAP session, as well as the public hearing for a comment on the rate determination schedule. And links to both of those calls were included in that e-notice. But we will share in the chat a link to that as well. So the first TAP meeting will be on the 13th of October to review the determination schedule. And then on the 26th is when we will have the public hearing so that providers and the public can provide verbal input and then also submit written comments. And then as
Mandy, sorry, someone noted that they're having a little difficulty hearing you. If you could speak up a little bit. And I'll also just note that the technical advisory panel, they are public meetings as per law. And so people are welcome to attend. There will be a period for public comment. But I will just say that there's there's a second entire public session with more time for folks to digest information that's devoted to comments on the stakeholder session. So we're hoping that the majority of comments will really be in the public session, just because the purpose of the first technical advisory panel meeting is for us, as per Chapter 639, formerly known as LD 1867, it's for us to receive consultation from the panel regarding the schedule.
Right. So I'll repeat the date. Somebody said that they couldn't hear me.
They put them in the chat.
Oh, okay, good. Okay, good. So other than that, the rate study updates, behavioral health, 13, 17, 28, 65, and 92. The draft rates were presented back in September the 20th through the 23rd, and public comments are due back October 14th. For ASCH and day health, adult family care home day health surveys are out in the field. We did recently extend the due date from September 23rd to October 11th. We weren't getting the participation we were looking for, so we've extended that. And then for crisis services, the survey is also out in the field, and those are due back October 20th. And for FQHCs, we are currently working on scheduling the first kickoff session. That was the update for rate setting.
Great, thanks, Mandy. And I'll just say that while the comment period is still open, just as a reminder to folks, there was also an e-message that went out that had links to all of the information that was shared at the forums about the rate models. So whether you attended or you weren't able to attend, that information is all available for you to review. And I'll just say that it's really helpful to get comments that are specific and data-driven back. So, for example, saying, we don't think the rate is high enough. I'm not saying that anybody here would just say that statement alone, but some people do, and it's not really like a very actionable comment, because we run through or Burns ran through in detail, like what assumptions go into the rate. And we really need you to tell us, like, this assumption about productivity is wrong, or, you know, this assumption about what kind of position is appropriate for this service doesn't seem right to us. Like, that's the kind of level of granularity that we need in order to be able to determine if a rate needs to be further adjusted than what we initially showed. So please be as detailed as you can in your comments, and that's really helpful.
Any questions? Amanda, were you trying to say something else?
Kathy,
I am gonna put the dates that they've asked for. Somebody had mentioned they wanted the dates for the comment deadlines, so I can put those in the chat.
Great. Regina?
It sounds to me like MaineCare, you guys have a ton going on, and yeah, I mean, you do, which is a good thing. I'm just trying to figure out how the average person knows any of this whatsoever. I mean, I think Sarah asked a really good question earlier, which was with the new, and that mobile thing is pretty cool. I don't know if the people on here that did it. My question was, is it gonna translate over to the computer one? Because that one's, I'm not gonna tell you guys, you already know it's messed up, but so how does the average person know any of this? And then my follow-up to that is, how does the average person who doesn't speak English know any of this? And that might be too loaded of a question, especially when we're on a tight agenda.
Michelle, can I take this? Regina, this is absolutely not too loaded of a question. These are questions we're trying to wrestle with internally. So one of the points, and it's I'm jumping around the agenda here a little bit, but on my communications update, we are working on putting together a rate setting page on the MaineCare website that lays a lot of this out. But the reality is, it will lay it out in a way that someone who's a MAC member will probably understand, because you've been part of the conversations when we say rate by section of policy. You go, yeah, I know what the MaineCare benefits manual is, and I know that it breaks how it pays into sections of policy, and like that is an orientation. Like folks have to get up to speed to know that. And I think that the reality of where we are at as an organization is partially trying to just communicate better, even with people who know this stuff. Making sure that we have our rate setting schedule will be on the website so MaineCare members can get access to it. Make sure that folks can easily, know, hey, the public health emergency is coming out and here's the plan for it. Like these are the sorts of things, to your question about how does the layperson understand, and how does a layperson who maybe English is not their first language understand? Those are real challenges that we're wrestling with, and we're trying to hit, how do we communicate effectively with folks who do understand, and who understand these systems and these conversations. But like there is, as you said, so much going on. How do we set up the arenas and communication tools to do that effectively? That's partially why I'm here in my role as Director of Communications and Planning, to try and figure that out. For rate setting, we're working on putting up a web page. For the public health emergency, we just launched this web page. We had the public forum where we had the directors presenting on MaineCare, on the department's plan. That's what you hit the nail on the head. How would we communicate this effectively to members, and so that it's comprehensible and reasonable, and they could weigh in on how it affects them? We're trying to build there.
Eric, I really do. I appreciate that. And I don't mean to be critical at all of anything anybody's doing, because it is a ton of work. But MaineCare has been MaineCare for a very, 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 very long time. I mean, I don't know when MaineCare was MaineCare, but anyway, and so I guess I'm just thinking that, wow, maybe MaineCare should meet with the community and tell them, hey, we're MaineCare, and these are the rules. I mean, I don't know. All I know is, again, MaineCare's been doing this for a long time, and there are people out there that have no idea. I had to apply for a MaineCare application for my mother and my father. Let me just tell you, it was a mess. Okay. So I'm not only coming at it from a provider who is doing this work and trying to help the community, I'm also coming at it from somebody who does this work and still, let me just be clear, was really and truly cussing everybody out at the state when I had to fill out that MaineCare application and send in literally a thing like this into MaineCare so that my father could stay in his long-term care facility. So anyway, I don't want to derail this meeting because it was going well before I spoke up. And so I think you get my message, and I will mute myself.
Well, Regina, first, these comments are actually comments we need. The only way we're going to get better is if we hear what the problems are, and there are plenty of problems, and we need that information. And also, in my new role and lack of speed at my new role, I am hopefully going to be moving forward with hiring on some folks into member engagement roles to put together a member engagement team to like work on these problems more directly with members, and try and tackle some of these problems exactly as you're talking about. So please don't, this is the feedback we need. So appreciate it.
Yeah, I just want to echo Eric. I don't think you said anything that takes things off track at all. And one other thought I had, just in terms of the rate stuff specifically, I know we've had conversations before about like, how do we what's the role from MaineCare members in the rate setting process, and how do we actually engage people when they don't know the codes and the sections of policy and all those details. And one thing I think would be good to try to figure out more about how we get to this is better hearing from members about what they can't access, because not that lack of access is always a rate problem, but certainly if you're hearing from providers that the rate for a certain section is not adequate and it makes them reluctant to take MaineCare or whatever, and then you're hearing from members that they can't find providers who provide that service, like that's some data that can go together. So just naming that as something that I think we good to continue to think together about how we can make space for that actually feels safe for members and also like, you know, is approachable for members.
And I'll just second all of the above. I will also say that when my main connection, so hear you, Regina, on the unfortunate experience of your application, which is why OFI put my main connection as being like a huge priority for improving that process. And so we're really excited that that has gone live. And when it did go live, we didn't initially want to immediately shout it through the bullhorns because we wanted to make sure that it was working properly. So we're having conversations about how to better get the word out, and we can do some of that on the Autism MaineCare services side of things as well. And so we will. And yes, like doing a better job at member engagement is, like Eric and I talk about it a lot, and it is like up there on the priority list. And so I'm really excited for the conversations that we'll be having and the changes that you'll start to see.
Thank you. Okay, so still in rates, want to give Laura Cordes some space for the subcommittee updates.
Thank you. So the rate subcommittee met last Monday, and now that the new rate setting system is underway, we spent most of our time discussing our transition to the permanent rate system subcommittee codified through the passage of LD 1867 last session. And we are welcoming MaineCare staff members to our meeting next month, which will take place on Monday, October 24th at 2 p.m. My apologies. I had that in the queue, but accidentally sent it earlier in the meeting. So I will put it back in the chat, and I know it'll go out with the notes from this meeting as well. And I might assume that we might have a new department Zoom link for that meeting as we move forward. These meetings have always been open to MAC members and remain so. And similar to the discussion we've been having with Regina, Eric, and Michelle about, you know, how do we open up our meetings, and particularly this rate system subcommittee, to other stakeholders and MaineCare members themselves, will certainly be part of our discussion as we go forward. And we did spend a few minutes talking about a couple other items that I'll flag here: the timing and progress around the Chapter 1, Section 1 rounding rule. If we could have an update to see if the state is still on track to have that go into effect January 1. We also would like to suggest to the department maybe hold a session with folks who are interested in understanding a bit more about the rule. I know I've received some questions about how to interpret it in certain sections, and that may be beneficial to helping folks get that right as we make that change. And the other question was about the timeline and progress around Section 106. The department did a fantastic job of engaging stakeholders, I think about January or February of last year, and walk through the timeline. And I think, if I remember correctly, we were getting close to maybe seeing a draft of that rule. So it would, you know, go through major substantive legislative, review in the spring with the adoption to have in place by the start of next fiscal year. So any updates on those two items would be appreciated. Thank you.
Any questions?
Kathy, I'm going to post in the chat if it comes out funky formatting, then I'll try to repost it in a way that looks better. But I was going to post just the draft schedule for finalizing the rate determination schedule because there's prescribed things that we need to get to. And I just wanted to share that because it includes discussions, to Laura's point, with the subcommittee and comment deadlines. So I'm going to see if this translates into the chat. And if not, I can send out an email with this copied and pasted so it is easier to look at.
Thanks. And this is actually not specific to rulemaking, but I did want to just name, I didn't put this on the agenda, but just to name, because we've had a lot of conversation around it, that the adult dental benefit rule is now final. That includes rates and changes there. And the dental subcommittee is continuing to meet as well. We normally meet on the second Monday of the month at noon. However, that's a holiday this month. So we're actually going to meet also on October 24th at noon. So I'll put that in the follow-up as well, just in case anybody wants to join. That's again open to anyone who wants to attend, and many different MAC members do attend. So that's exciting progress that we're making. And actually, I forgot to ask about this, Laura, but could we also have an update for section 106?
So Kathy, I think we're transitioning to my update. Is that right?
Yeah.
Okay, that's perfect because
good. Okay.
Your questions I think are more on rulemaking and policy, so I'm happy to address them. And Kathy, thank you for the reminder of the dental subcommittee meeting. So yes, our biggest news on our rulemaking update is the adoption of the permanent dental rule, which was officially adopted last week. It is now in place, and we are very happy and eager to have any conversations that would be helpful now that the rule is final. And Eric may talk about this a little bit more, or others, but we've been asked to join the Maine Dental Association quarterly meeting in December, and so we are planning on bringing some staff members there just to talk about it and answer questions. And we're also happy to have folks join the dental subcommittee of MAC. If it would be beneficial to talk now that the rule is actually in place, and we're very excited about that. I think the other. So I will get an update on section 106. Section 106, yes, thank you, Laura. We are working very diligently on that because we do need to get it out and proposed before the end of the year. So we are looking forward to that. I don't think there are substantial changes from what we presented back in January, I think, at the stakeholder sessions. But as we discussed there, one of the things that we're excited about is that there is the link with the rate setting process. So in the rate study that's ongoing for behavioral health services, that does include the children's services as well. So we're looking to time that so that we can get all of it in place. Stay tuned, and we do hope it will come soon. And then I also heard your comment, Laura, on the rounding rule and whether the department could schedule a session on this. So I will take that back to see whether we can do that. So I think the other late breaking news, which actually is too late breaking to be in our packet, is that today we posted notice of our non-emergency transport waiver amendment application. So that comment deadline, it does not appear in our little highlighted section of the update, but that comment deadline is November 4th, and our own Lisa Weaver, who's on this call, is the contact person for comments. And so I will post in the chat just the link where folks can find that notice. There's both the notice, and then there's also a PDF with the draft waiver amendment there. I will warn you that when you go to that link, you have to scroll way, way, way down to find this you have to scroll way down because all of the waivers are organized, and they're organized by section of policy, and the section of policy for non-emergency transport is section 113. So it's a good ways down. I had trouble finding it myself this morning. But basically, the short version of what that posting is that we do have a waiver which enables us to use a broker system, and so that waiver has to be periodically renewed. And so this is the application to renew that waiver. There are not a lot of substantial changes, but it is the opportunity for public comment on that waiver. I think the biggest change that we're proposing is that there will be a single capitation rate per region that has been determined by the state. So rather than allowing bidders to select from a range of actuarially sound rates, the rate basically is set for the region. And so the bidders for the brokerage will be competing on quality and experience. So that's the biggest change. I just want to make sure folks were aware of that because November 4th may or may not be prior to our next meeting. Other than that, not a whole lot new in the rulemaking update. We do have a lot of things on our plate and a lot of things that we're wanting to move forward, and I'm happy to answer any questions that folks may have.
Questions?
Kathy, I did want to, if there's nothing on today's report, I just wanted to note Molly's link in the chat that the job bulletin for our MaineCare member engagement manager is live. And this is a fantastic group to share that far and wide. So we please ask you to do so. I'm very excited about this newly created position. So find that link and send it to folks that you know may be interested.
Thank you. So Eric, I know you did share some communications information already, but do you have other updates that you'd like to share?
Yeah, basically I'll just do a quick full 4 bullet point. The public health emergency unwinding, everyone on this, every MaineCare, every MAC member was invited to the meeting, but if you didn't make the meeting, we already shared the mainecare.gov/PHE goes to an unwinding website, which has a recording of the meeting that OFI, the Office of Health Insurance Marketplace, and MaineCare gave on Thursday. Please, if you're trying to understand what the public health emergency unwinding is, go and check that out. To redouble on the point that came up during the rate setting discussion, we are working to put together a rate setting page so that there will be more information and more easily understood information about the different rate setting processes that are occurring. That will be on the OMS page, and we should, as we move forward with the various parts of our rate setting process, we're going to need that page. We're working to make it understandable and navigable. So we should have that up probably by the next MAC meeting. The member engagement manager position is posted. This is part of exactly what Regina was talking about, trying to figure out how to better collect, understand member experience and improve MaineCare as a result of that understanding. And if I can give an extra plug, they're going to be working directly with me on my team. So if that sounds pleasant, that's that. And then lastly, we are recording these meetings. The MAC page on the MaineCare page is going to start hosting the recordings. So if we want to make sure as we get back onto the cycle for MAC MAC appointments and elections, that we're also getting adequate information out so folks who are interested in what the MAC is doing and what the MAC means can see that on the OMS page. So just wanted to flag that it shouldn't, Lori, I can share for you the unwinding page, that we will have this on the up on the OMS website, and we're going to make that a practice moving forward, is having the recordings available. So Regina's point is one close to my heart. We need to figure out how to communicate better with all audiences, and I think there's no one on the MaineCare team that would disagree with that. So we're trying to figure out how to do that well. So we welcome feedback and appreciate the gentle nudges on things that we could improve on. That sort of criticism is how we grow. And so thank you all for giving that feedback. And I guess I should go one more, as Jenny mentioned, and actually it would be a demonstration of this working well. The Maine Dental Association flagged for us that they have some challenges that they're trying to figure out, and how can MaineCare be a partner in working through that. And we will be meeting with the MDA in December to help kind of talk through some of the challenges that dentists are experiencing with the new rate setting. It's our aim to be a good collaborative partner. So one, that will be happening in December, and two, that's the sort of accessibility we're looking to make for partners in figuring out how to ensure the folks of Maine and make sure they have the healthcare they need. So thanks to you all for your support in that. And I think that's it, unless there's any questions.
Thanks, Eric. Any questions? I actually have a question that I think is either for Jenny or Michelle, probably, but you reminded me of it when you were talking about the unwinding meeting, Eric. I know that you didn't get into like policy details in that meeting, but can you share with us if there's any plans to use some of the flexibilities allowed for the unwinding in order to streamline things for folks? For example, like the 1902 waiver authority that can allow you to renew Medicaid eligibility for SNAP participants without conducting a whole separate MAGI income household-based redetermination, which is specific to the unwinding. It's not something you can normally do.
So I will say that, Kathy, after this session, there was acknowledgement that we needed to answer that question more in full. It was a hard question to answer on the spot because some of that evaluation is still going on. I will say that those are flexibilities that OFI is lead in terms of looking at what may be possible and what's not. So I can't speak to that, and I don't think MaineCare can speak to that. I don't want to put Esther on the spot, but I will just let you know that, like, we heard the question, we will be answering it, and part of what we were doing after the forum is based on questions that came in, to look back at the FAQs that we developed and posted on the website that's in the chat to see if there are any gaps, and we will be filling in those gaps. So not a very satisfying answer on the spot, but we will be getting back to you.
That's okay. That's helpful. Thank you.
Yeah, what Michelle said is completely accurate. OFI is certainly looking into every possible option that will make unwinding go as smoothly as possible and lead to the fewest interruptions in coverage as possible. And we'll certainly provide a more succinct answer in the future.
That's great. Thank you.
I just wanted to echo something Esther said, that like this is a cross DHHS collaboration. Like OFI has pieces, OMS has pieces, OHIM is going to be a key partner, and we're working hard to figure out how to weave those together as effectively as possible.
And for people who don't know OHIM, it's the Office of Health Insurance, is it Marketplace or Management?
Yeah, Health Insurance Marketplace.
Powerme.gov.
Yeah. Thank you. All right, well, we're a little ahead of schedule. Our last agenda item was just some logistical things around MAC meetings, and one mainly being that what we've been trying to do is anticipate the possibility of snow in certain months and set a backup date in those months, primarily December, January, and February, though we know it's Maine and could happen in other months as well. Even though we are still meeting virtually, we do a snow day if the state is closed because state workers are not working. And also, usually on those kinds of days, there's other challenges for members also, just in terms of being able to participate. So what we have been doing the last several years is taking the second Tuesday of the month at 10 a.m. as the backup date. And I actually haven't even looked at those dates, so I should double check that none of those are holiday, but I don't think they would be. But unless someone has a different proposal, my suggestion would be that I can connect with Lisa Weaver to make sure that that date works for MaineCare, for the DHHS folks who attend these meetings. And then we could hold those with calendar invites as snow dates. But if anyone has a different suggestion, please feel free to speak up. Okay, so that's what we'll do. And Lisa, I'll follow up with you. And then there have been a few questions about, like, will we continue to meet virtually? And for now, we are going to continue to meet virtually. I think it'll be a challenge to find a space that we can adequately fit all of us and maintain the participation that we've had since going virtually. But that's something we can revisit in the future too, as circumstances continue to evolve and change. Any questions? Yeah, go ahead.
I was just going to say, just for a little bit of context, since Labor Day, DHHS employees are physically in their office spaces at least 2 days a week. And we are trying to have a good practice of when we're in the office to actually be in conference rooms together, because that's part of the benefit of in-person work, is to actually have FaceTime with your colleagues. So that's why you see us in a conference room today.
And that's also one of the logistical challenges, is that because staff are using those conference rooms, there isn't necessarily a space that we could use without interrupting the flow of work. So for now, that's what we're going to keep doing, but we can talk about it again in the future if it feels necessary. And if anyone is having any troubles accessing the meetings, like, please, as always, feel free to reach out and we can try to troubleshoot those. Any other questions about logistics for the meetings? Oh, I see your comment. We were going to follow up about this separately, but I'll just say it since you just put this in the chat, that I know that it was talked about at the meeting that folks who only receive electronic communications would not receive the blue striped envelope. I will note that, like, I've heard from now several partners that we work with as well that do a lot of work with members about concerns about that, just given that for the last several years, people haven't necessarily, there's no consequence if just for MaineCare, obviously it's different for other programs, but if you've not paid attention to notices, you wouldn't have lost your coverage. So people in their emails, so they may not even realize, like, if it's going to their spam or something like that. So just naming that, I think there's definitely folks like Maine Equal Justice who would urge considering sending out the blue striped envelope one time to everybody, even if they say they want electronic communication, just to kind of have a backup, given how big this process is going to be.
Kathy, your comment made me realize that I might have made an incorrect assumption. Esther, was it an option under the old MaineCare, My Maine connection, to say that you only wanted to receive electronic communications, or is that a new option?
It was an option, although I think that there were a couple of exceptions in terms of the letters that we send. I believe that there were a couple of letters that we would send paper copies also, regardless of the selection made. Kathy, I hear your concern. Michelle and Kathy, I'm not confident that those who have elected electronic communications only will not receive a paper copy. I need to confirm that.
Dan Cohen had, or maybe it was Leah, somebody from OFI definitively gave that answer. But agree that it's good to confirm, and also appreciate the feedback, Kathy, and I'll take that back to our cross office working group to see if there's anything we can do there.
Thank you both. All right, well, I think that's it. I don't think I heard any new, I mean, we have a bunch of standing agenda items, and some of the things that came up touch on those standing agenda items. But I don't think I heard any new agenda items for November. Speak up if if I missed something. As always, I'll send out a request for items, so you'll have a chance, and you can send me items anytime that you're interested. And I hope you all have a wonderful rest of your day.
Thank you. Thank you.
Thanks all.
Thank you.